of deaths per day dropped below 1,000 for the first time since November. All of this is really good news. And while these trends are starting to head in the right direction, the number of cases, hospitalizations, and deaths still remain too high and are somber reminders that we must remain vigilant as we work to scale up our vaccination efforts across this country. We must continue to use proven prevention measures to slow the spread of COVID-19. They are getting us closer to the end of this pandemic. As I discussed on Monday, CDC released initial guidance on activities fully vaccinated people can resume safely while limiting risks to themselves and others. To help this important information out to the medical community and to the public, today, the Journal of the American Medical Association published a scientific commentary from CDC. In the commentary, we again summarize the new recommendations from CDC, that fully vaccinated people can visit with other fully vaccinated people in small gatherings without wearing masks or physical distancing, that fully vaccinated people can also visit with unvaccinated people from one other household without wearing masks or distancing, as long as no member of the unvaccinated household is at high risk of severe illness from COVID-19. And that fully vaccinated people do not need to quarantine or get tested following contact with someone who has COVID-19, as long as the fully vaccinated person is asymptomatic. We also reiterate that in other scenarios, including public settings and travel, people who have been fully vaccinated should continue to wear masks and practice safe public health precautions, just like people who have not yet been vaccinated. In addition, the commentary includes information about the scientific basis for CDC's new recommendations that balance the risk of fully vaccinated individuals with the risk of infection and spread among the still 90% of the American public not yet protected by a COVID-19 vaccine. The commentary also describes the outstanding scientific questions we are working to answer to inform future guidance and get people back to their everyday activities. Key among them are questions about the risk of vaccinated people transmitting the virus to others if they have a vaccine breakthrough and become infected, how long protection from vaccine lasts, and how well the vaccine works against the circulating virus variants. While we are starting to see emerging evidence that the vaccines remain effective against circulating variants and that the risk of breakthrough infections in vaccinated persons and spreading the virus to others is low, we must be resolute in our efforts to fully answer these critical questions. When answered, they will inform the future guidance that will enable us to safely resume activities while also protecting others who remain vulnerable to this disease. We are working across the government and with many scientific partners to answer these questions as quickly as we can. And I'm committed to updating our guidance as new scientific information becomes available and, importantly, as more people get vaccinated. I want to close by reiterating that our actions this week represent a first step, not our final destination. We are at a critical point in this pandemic and on the cusp of having enough vaccine to protect every adult in the United States. We ask for your patience in practicing proven prevention measures for just a little while longer. We ask for your participation by rolling up your sleeve when it is your turn to be vaccinated, and we ask for your leadership in helping others do both of the same. With the above actions, we are so very close. We can turn the tide on this pandemic. Thank you. I look forward to your questions, and I'll now turn things over to Dr. Fauci.